how do we recognize depression in ourselves or in a family member or a friend?
Yes, Washington. Last time we discussed what we mean by depressive disorder. So what we thought of, we will on this recording video, we will discuss the other signs and symptoms of depression, other than the lowering of mood, which of course is the main symptom. So generally, when we discuss about what we call the core symptoms or the cardinal symptoms, we think of the three A's which are easy to remember. So the A's stand for anhedonia, asthenia, and apathy. Of course, these are all derived from the Greek, but just to explain a bit more, anhedonia means a lack of capacity to enjoy what the person used to enjoy in the past. And apathy is lack of interest. And again, it denotes lack of interest in things which you were previously interested in. And asthenia is another word for a feeling of lethargy and exhaustion, which is also a core symptom. But however, you find this also in a lot of other medical problems as well. However, this exhaustion is a bit different. It's more kind of a mental exhaustion rather than a physical exhaustion. So just to go back to a bit more explanation, anhedonia, or the lack of enjoyment, means that the person who used to enjoy certain things in the past no longer derives any pleasure from these things. So somebody who liked cricket very much will not watch cricket anymore because they lost they don't enjoy it anymore, right? So this change is what is important. Obviously, if somebody never liked cricket, that is not a sign of depression. So we look for things you used to enjoy and then ask, okay, do you still enjoy those things more, such as playing with the children or talking with other family members and so on. So if that is there for more than, again, 2 weeks, that's another important sign of depression. The second A, or what we call asthenia, means lack of interest in the things which you used to be interested in before. That is, of course, self-evident. And the third one is the exhaustion. So the interest, lack of interest, apathy, and then the asthenia together. So these are the three A's, or the what we call the cardinal core signs of depression. Of course, all those, all four, that's including the mood, need not be present to diagnose. However, if the mood, lowering of mood and at least one core symptom is there of the three A's, that is sufficient to diagnose a depressive disorder versus what we discussed as normal depression of a person. Right. Of course, in addition to these core symptoms, there are what we call additional symptoms, or what we call accessory symptoms, which go along with the core symptom. So out of that, again, looking at the what we call the mental symptoms, which are common in depression, lack of concentration is a very common thing. People report that they are unable to do their normal work, mainly because they cannot concentrate on what they're doing. Their mind wanders. And then there's this sense of there's irritability with people and just with the world. You get annoyed for little things, and that's another associated the sign of depression. And so these are what we call the cognitive associated signs. And then, of course, there's a very important group we call the somatic symptoms. Somatic means body. So there we have your sleep is affected. And most often in depression, what happens is you wake up very early in the morning. It's called early morning insomnia or late insomnia. So you wake up 2 or more hours before your usual getting up time. And then you find you can't fall asleep again. So the whole house is asleep and you are awake. That's called early morning insomnia. That's a fairly important somatic sign. And the other one, of course, is loss of appetite. And that leads to weight loss. However, in some people, they have an increased sleep, what we call hypersomnia, and they eat more and they gain weight. So that also can happen, but that's rarer than the other side. And of course, there's a serious effect on your sexual function, so that we call your libido. and that is almost always affected in a depressive disorder. And of course, leading on to the most important of the cognitive, there is a tendency to have thoughts about death and dying, and maybe even in more serious cases, you think of harming yourself or actually killing yourself. So these are very dangerous signs of depression, and that's more seen in the more severe depressive disorders. So this is a kind of spectrum of signs and symptoms that we get. So the more you get, the more likely the diagnosis is more definite. And of course, these have to last more than, as I said, 2 weeks. So that's how we diagnose depressive disorder.
Are we able to diagnose depression in a shorter period of time? Let's say a person has been having all these symptoms for a few days or a week. As a psychiatrist, how would you approach a patient like that?
Yes, of course, the 2 weeks is arbitrary international convention. However, it doesn't mean that somebody with a week of depression and these symptoms are not depressed. Also, it does not mean that we wait another week just to be sure of the diagnosis before we proceed to help the person. This is just for research and to make sure that the data is accurate. So yes, you can even diagnose in a week, but perhaps not in a few days. Of course, practically people will not come to a doctor with a few
Yes.
days of symptoms, very unlikely. So they will most often come way after